Hello everyone, welcome to YouTube channel of Shree Swaminarayan Physiotherapy College, Ranip, Ahmedabad. I Dr. Heena Parmar, Assistant Professor at SSPC. Today we will learn special test for hip joint muscle pathology.
Hello everyone, first we perform the AS test for rectus femoris tightness. For this test, patient position will be prone. Examiner will stand beside the patient. Then examiner will passively do the knee flexion. If the patient will spontaneously do knee flexion, then test is positive for the rectus femoris tightness. Now we perform the candle test for the rectus femoris contraction. For this test, patient position will be supine. Knee bent over the edge of the examination table. We'll ask patient to do knee to chest of the non-tested leg and examiner have to see the angle of tested leg at 90 degree. If it does not, then test is positive for the rectus femoris contraction. Now to the triceps for the hamstring contracture test. For this test, patient will be in a sitting position at the edge of the examination table with the both knee flexion at 90 degree. Then examiner will do passively extension of the tested leg. If patient will do extension of the trunk and to release the hamstring tension, the test is positive for the hamstring contraction. Now we perform the piriformis test to check the piriformis tightness. For this test, patient position will be sideline. The tested leg will be uppermost. We'll do the heel flexion at 60 degree, then knee with the knee flexion, and knee should be outwards towards the knee. Then examiner will stabilize the hip with the one hand and then apply downward pressure to the knee to check the tightness of the muscle. After downward pressure, if the pain is elicited in the piriformis muscle, then test is positive for the piriformis tightness. Now we perform the normal compression test to check the iliotibial flexor syndrome is present or not. For this test, patient position should be supine. Knee should be 90 degree flexion and examiner will apply the pressure at the lateral femoral condyle with the thumb, or we can apply 1 to 2 cm above it. For this test, patient will do actively knee extension at or around 30 degree. If patient complains of severe pain at the lateral femoral condyle, the test is positive for the iliotibial flexor syndrome. Now we will test the Ranip sign test. For this test will assess the stability of the hip and ability of the hip abductors to stabilize the pelvis on the femur. For this test, patient position will be standing and we will ask patients to stand on the one leg. Normally, the opposite side pelvis should be raised, then test is negative. But if the opposite pelvis will be dropped, then test is positive for the hip abductor weakness of the standing leg.
Thanks for watching. Please do like, share and subscribe.